Good evening, I'm Judy Woodruff on the Newshour tonight. A troubling surge. The world marks its highest single-day total of new coronavirus infections yet, as the president walks back remarks about slowing down testing. Then, jailed for Germany.
Major funding for the PBS NewsHour has been provided by...
When the world gets complicated, a lot goes through your mind. With Fidelity Wealth Management, a dedicated advisor can tailor advice and recommendations to your life. That's Fidelity Wealth Management.
Consumer Cellular. Financial services firm Raymond James. Johnson & Johnson. The Chan Zuckerberg Initiative, working to build a more healthy, just, and inclusive future for everyone at czi.org. The William and Flora Hewlett Foundation, for more than 50 years, advancing ideas and supporting institutions to promote a better world at hewlett.org. And with the ongoing support of these individuals and institutions. This program was made possible by the Corporation for Public Broadcasting and by contributions to your PBS station from viewers like you. Thank you.
The COVID-19 pandemic has infected more than 9 million people worldwide as of tonight, and deaths in the United States have topped 120,000. All of this as the pace of the pandemic gains new momentum. Amna Nawaz begins our coverage.
In Geneva today, a grim new record confirmed.
Yesterday, more than 183,000 new cases of COVID were reported to WHO.
That represents the biggest daily surge in new COVID-19 cases since the start of the pandemic, all logged by the World Health Organization within 24 hours this weekend. In Brazil, the world's highest spike, a startling 54,000 new cases, almost a third of all new infections. In India, more than 15,000 new cases, and hospitals already under strain are now turning away patients. Meanwhile, here in the U.S., more than 36,000 new cases, roughly 1/5 of the global surge. Some states that had already moved to ease restrictions are now seeing new cases rise. A dozen states across the South and Southwest reported record increases this past week. Oklahoma, where on Saturday President Trump held his first indoor rally since March, is also reporting new highs, blaming the spikes on encourage to curtail testing. Meanwhile, the Trump camp from the World Health Organization say scaled-up testing is not the only driver behind the latest spike in infections.
We do not believe that this is a testing phenomenon. Clearly, when you look at hospital admissions are also rising in a number of countries, deaths are also rising, and they're not due to increased testing per se.
In New York City, Mayor Bill de Blasio said testing is what allowed the city, once the epicenter of the U.S. outbreak, to move into its next phase of reopening today.
This is a game changer. Remember, we didn't used to have this on a massive scale, nor did other cities and states around the country. Now, we are doing the thing that has worked in so many other parts of the world. We're proactively reaching people who test positive or people who are symptomatic and need help.
More than 300,000 New Yorkers were allowed back into businesses and offices today, while barbershops and hair salons welcomed customers inside for the first time in more than 100 days. For the PBS NewsHour, I'm Amna Nawaz. The surge in cases in India, Brazil, and other countries is especially concerning. It also bears repeating that even though the number of deaths have dropped in the U.S. from the initial peak this spring, more than 600 people a day are still dying in the U.S. from COVID. Some perspective on all this now from an expert who watches the global transmission of the disease. Stephen Morrison is Senior Vice President and Director of Global Health Policy at CSIS, that's the Center for Strategic and International Studies, and he joins me now. Stephen Morrison, welcome back to the NewsHour. Let's start overseas now, where we're seeing some of these enormous surges, specifically in Brazil. 54,000 new cases. Why is there such an alarming surge happening right now?
Well, it's a number of factors. I mean, testing has expanded a bit, but that's not the main factor we're looking at here. There was a lockdown for a period, but it was very flawed. It was very fragmented. There's been a reopening. People have become complacent. I think probably the dominant factor is simply wretched national leadership in the form of President Bolsonaro, who has had open scorn for science and for this virus, has embraced hydroxychloroquine, has had contempt for his governors who've been, attempted to put in place quarantines, has called for mass rallies, has done pretty much everything possibly wrong, and his support and legitimacy has collapsed. And so the epidemic is concentrated in large urban centers where there's high slums, and it's very hard to social distance. Access to water is oftentimes quite problematic. And so we're seeing a surge
case in China in December 2019.
Sao Paulo, Rio de Janeiro, and the
It
Northeast.
came to USA.
So it's really quite a dangerous situation. Over 50,000 dead, a million cases. They could quickly they could, in the course of this summer, overtake
That's
the
not
United
good
States
to go to
in
the
terms of the
hospital
numbers
in
that
a
have died.
COVID-19 pandemic.
Let me ask you about India as well, which has also caught a lot of people's attention. Now, Prime Minister Modi there did lock down the entire country back in March, 4 weeks. You're talking about over 1 billion people across the country. So why are we seeing this spike now, all these weeks later?
Well, again, you had a 77-day lockdown in India, and that had some impact in dampening the curve, but it was unsustainable. You had over 100 million migrants who were impoverished, informal sector workers who were let loose and migrated back across the country to their homes, carrying the virus with them oftentimes, and he had to relent. So that there was finally a lifting of this, but they did not have the systems in place in their health system. Their health system in the public sector is woeful. Testing has been terrible and remains terrible. And so you're seeing a surge. Again, not unlike Brazil, you're seeing it in Mumbai and New Delhi. These huge urban concentrations is where we're seeing the hotspots right now.
And what about here in the U.S.? As we reported earlier, dozens of states are now seeing an increase. Is the increase in infections that we're seeing just due to an increase in testing here?
No, I think what we're seeing in the United States is a surge, an acceleration of community transmission. There's no question testing has increased. Our peak testing was just under 600,000 per day, but on an average day, it's about half that much. So testing has not increased all that much in terms of actual testing. But what we are seeing here is a new normal. I mean, yesterday we had 37,000 cases. That's an astronomical number. And it gets back to, we had a lockdown that had an impact. It was lifted prematurely. People have reverted to complacency. They have not continued in terms of social distancing and use of masks and hand washing. And we're seeing a surge of cases, particularly in the West and the South, and increasingly in parts of the Midwest.
You also heard us report that President Trump had mentioned